In Uganda, many young people, especially in remote and underserved communities such as slums, fishing and landing sites, face challenges accessing reproductive health services like antenatal, family planning, HIV counseling and testing, and so on. The Youth Track brings these services and information to their doorstep.
Yes! Olunaku lwanca akyali wakasambyako. This is the mobile youth track. Colours of Action for Uganda.
Equipped with advanced technology, including a solar system and public address system, the Youth Track travels to these communities, offering a unique blend of education, health services, and community engagement.
In a country like Uganda, where services are not readily available and accessible, and due to long distances from the health facilities, the Youth Track helps us to bridge that gap by taking these services in communities at no cost.
The Youth Track also serves as a resource center for youth, providing educational materials, counseling services, and referrals to appropriate healthcare providers as needed. Furthermore, the track also mobilizes and inspires young people to assertively advocate for and prioritize their health, actively engage with the political sphere, and provide a platform for life skills education.
The Youth Track is not just a vehicle, but a classroom, a mobile clinic, and a platform for change. It supports health workers in taking health services in communities which are far from health facilities. It also enables young peer educators in reaching out to their fellow peers who, for different reasons, may not have access to the right information regarding their sexual reproductive health.
With the help of Action for Health Uganda trained peer educators, the Youth Track is able to bring all these services closer to the youth and their communities.
My name is Apuka Rita. I'm proud to be a peer educator with Action for Health Uganda. Action for Health Uganda trained me as a peer educator. Now I'm teaching my fellow youths on how to take care of themselves and live empowered lives.
The peer educators and the organizers for Action for Health have come to visit our community and have taught us very many things. Like, for example, how to use a male condom. Me as a boy, I was taught how to use a male condom.
And also we thank Action for Health Uganda on bringing these services. It has helped us so much on controlling HIV diseases and teenage pregnancies.
In my community, it's the first time I'm seeing this track here for the peer educators. So I'm very privileged, not only me, all the entire members in the community, because the activities they have brought, they will have good impact on their lives.
Today we had a game which was organized by Youth Track. The peer educators helped us to teach us how we can take care of ourselves. They also helped us to bring some health activities, and they brought for us doctors which helped the community members.
The Youth Track uses SRHR themed sports galas as a mobilization tool to deliver integrated health services and information to underserved communities while partnering with the community health facilities.
We have had a health outreach on the island powered by Action for Health Uganda with the Youth Track. We've had laboratory testing services. We've had HIV testing services, malaria. People have been tested for all sorts of diseases. Action for Health Uganda has been advertising ever since they stepped on the island, and natives literally got to know about this day. That's why the fruits have been good. They've turned up in good numbers.
Kwekebeza sirimu nenfunyemu ekirungi mbadde nsuubira nti ndi mulwadde nenfunyemu ekirungi nti ndi mulamu. Abalwadde bafunye eddagala n'abalamu tufunye ebitwadde twetaaga. Tukubiriza abavubuka okufuba nnyo okwejjanjaba muleke kwerekerezeeyo nga muli balwadde.
I would like to thank the Youth Track for the good mobilization they have done. I want to thank them for extending the services to the youth. Our youth have been able to get the services that they really needed, though they didn't have access to them. And what I know is going to change their lives. They have been able to get all the services. They asked many questions, we interacted, and they are now contented.
The Youth Track joins partners to celebrate national and international days, enabling peer educators and health workers to disseminate health services and information to young people in the host communities, while also enabling the team to exhibit the organization's services. Prior to the national and international days, the track mobilizes young people in these areas and creates awareness about the events.
The van or the truck was really very important because very rarely do we go out and reach out. So the van was helping us to reach out to that other adolescent girl and boy who may not be at school.
Action for Health Uganda baze ne youth track wano munakasero okutuyigiriza engeri gye bakozesa mupaadi tusobodde okuba nga tuziiga bintu bingi ebyembadde nga simanyi kati mbimanyi kusaawa zino.
This year alone, the youth track traveled nationwide, delivering SRHR services and information to over 10,000 young people. Together, we've touched and made a difference in the lives of so many young people. But there is so much more to do. We must bridge the information and service gaps, ensuring no young person is left behind. Whether through donations, partnerships, or raising awareness, we can create a society where every young person is safe, healthy, and thriving.
Through this experience, my life has been changed. So I thank Action for Health Uganda for bringing these services.
We have managed to achieve this through our strong partnership with our young peer educators, health workers from over 32 health facilities, district local governments, DSW, and Max Bronze Healthy. Thank you so much, our dear partners.
No condom, no sex.
No condom, no